Good afternoon. My name is Ghayathri gunaseelan. My matric number is 2031 from DPH 45. Today I will presenting on a case study of pancreatic cancer. In this presentation, I will explain the patient case including the treatment plan and the pre-medication used. Throughout this case study, we can understand not only the disease itself but also how it managed in real clinical practice. Let's begin. What is the pancreatic cancer? Pancreatic cancer is a serious and aggressive disease that begins in the tissue of the pancreas, an organ that plays an important role in digestion and blood sugar regulation. Although it is less common compared to other cancers, it is one of the leading causes of cancer-related deaths worldwide because it is often diagnosed at the late stage. Risk factors including age, smoking, obesity, family history, and chronic pancreatitis. Symptoms such as jaundice, abdominal pain, weight loss, and loss of appetite usually appear only at advanced stages, making early detection difficult. Understanding pancreatic cancer, its treatment options, and supportive care is essential for improving patient outcomes. This case study involved a 60-year-old female patient diagnosed with pancreatic cancer. Based on a body surface area of 1.42 m², she was prescribed gemcitabine 400 mg IV as chemotherapy supplied using 200 mg vial of gemita to minimize side effects and prevent complications. Pre-medication were given. Palonostrone to prevent chemotherapy include nausea and vomiting, and hydrocortisone to reduce hypersensitivity reaction and improve patient tolerance. The patient was planned for 5th cycle of gemcitabine monotherapy, which is a standard treatment option for pancreatic cancer. Now, I will explain about the chemotherapy drug gemita, also known as gemcitabine. First, let's look at the chemo calculation of the drug. The available strength of gemita is 200 mg per 5 ml. The prescribed strength is 400 mg. So, using the formula, 200 mg equals to 5 ml, therefore 400 mg equals to 10 ml. That means the patient will need 10 ml for the prescribed dose. Next, let's look at the mechanism of action. Gemcitabine is a synthetic pyrimidine nucleoside antimetabolite. It works by inhibiting DNA polymerase and ribocleuronide reductases, which block DNA synthesis. It mainly targets the S phase of the cycle, and it may also arrest the G1 per S boundary. Now, moving on to the pharmacokinetic absorption, peak plasma concentration occurs around 30 minutes after infusion. Distribution, it is weakly distributed and found in the acidic fluid. Bioavailability, 50 to 70 for a 30 minutes infusion and about 370 for a 270 minutes infusion. Metabolism, it is metabolized intracellular into its active triporamine metabolites, which are the further metabolized into inactive DFDU. Excretion, mainly throughout urine, about 92 to 98%, within 99 excreted as DFDU. Half-life, short infusion is 42 to 94 minutes, while long infusion is 4 to 10 hours. Finally, the indication, gemita is used for locally advanced adenocarcinoma of pancreas and metastatic adenocarcinoma of the pancreas. The usual dose is 1000 mg per square meter, given by a 30 minutes infusion once weekly for 7 weeks, followed by a week of rest. After that, it is given once weekly for 3 weeks every 4 weeks. Alternately, some regimens use 1000 mg per square meter on day 1 and 50 of each 20-day cycle. Treatment must be withheld if the neutrophil count is less than 1500 per cubic millimeter of the planet count is less than 100,000. So, in summary, Jamita is a key chemotherapy drug for the pancreatic cancer, working by blocking DNA synthesis and stopping cancer cell growth. Before chemotherapy, patients are usually given pre-medication to reduce side effects. Here, the first drug of palanosotone, which is an antiemetic. The available strength is 0.25 mg per 5 ml, and the prescribed strength is also 0.25 mg. So, when we calculate 0.25 mg equals to 5 ml, this means the patient will need 5 ml, which is equal to 1 vial of palanosotone 0.25 mg per 5 ml given by IV. Palanosotone is mainly used to prevent nausea and vomiting caused by the chemotherapy. Chemotherapy index CINV adult 250 mcg IV bolus over 30 seconds, 30 minutes before chemo. For child 1 month to 70 years, 20 mcg per kg maximum 1500 mcg IV infusion over 50 minutes, 30 minutes before the chemo. Post-operative PONV adult 75 mcg IV over 10 seconds just before induction of anesthesia. The second pre-medication is hydrocortisone 100 mg. The available strength is 100 mg and the prescribed dose is also 100 mg. That means 1 vial is supplied for the patient. Hydrocortisone is given intravenously and is used to reduce inflammation, prevent allergic reaction, and also help enhance to the antiemetic effect when the combined with the palanosotone. The indication of hydrocortisone 100 mg IV is used for rapid corticosteroid therapy in emergencies such as adrenal crisis, severe allergic reaction, septic severe asthma, acute autoimmune flares, and cerebral edema, providing quick anti-inflammatory and immune suppressive effect to the stable the patient. So in the summary, there's two pre-medication, planoceterone and hydrocortisone are given before gemcitabine infusion to make the chemotherapy safer and more tolerable for the patient. Next, I will explain about the method or procedure for preparation intravenous chemotherapy drug. First, preparation. First, we verify the prescription to make sure the dose and drug are correct. Then, we wear personal protective equipment and follow aseptic technique. The clean area is prepared and all equipment and supplies are made ready. We also prepare the pre-medication for IV bolus. Step 2. Chemotherapy preparation. For this case study, for gemcitabine, the available strength is 200 mg per 5 ml. The prescribed dose here is 400 mg. So we calculate 200 mg equals to 5 ml. Therefore, 400 mg equals to 10 ml. That means we will need to withdraw 10 ml for the vial. Reconstitution is done with the 5 ml sterile water for injection per 200 mg vial. Step 3. Dilution for the infusion. The required dose 400 mg is then transferred into an infusion bag containing 250 ml of 0.9 normal saline. The bag is mixed by gentle infusion, avoiding vigorous shaking to prevent foaming. It is informed to note that gemcitabine is only compatible with the normal saline. Step 4. Administration. The drug is infused intravenously with the usual infusion time being 30 minutes. It must not be given as a rapid IV bolus or rapid injection because this increases toxicity risk. During administration, the patient is closely monitored for side effects such as myelosuppression, liver function changes, and infusion-related reaction. In conclusion, gemcitabine or Gemita is an important chemotherapy drug mainly used in the treatment of pancreatic cancer. Before chemotherapy, pre-medication like palonostrone and hydrocortisone are given to reduce nausea and vomiting and allergic reaction. The preparation and the administration of chemotherapy require careful calculation, strict aseptic technique, and proper dilution to ensure safety and effectiveness. Overall, following the correct procedure not only ensure accurate dosing but also minimize side effects and improve patient comfort during the treatment. Thank you.